Your doctor gives you a number. Maybe it's your A1C, your cholesterol, your blood pressure number, or maybe they ask you to monitor your resting heart rate with your wearable. And suddenly that number feels like the most important thing in the world. It's the goal, it's the metric, it's the standard. But here's the thing, most people don't change their behavior just because a number tells them to. And most lasting change doesn't come from tracking. It comes from shifting how you see yourself and the meaning you make of those numbers. So, Dr. Teplow, let's discuss how to move the needle on real health markers like A1C in ways that are flexible, human, and sustainable.
I love that. Flexible, human, and sustainable. That's quite a challenge, and it's doable. So one thing I want to say is that often we get stuck because we let the numbers define us, especially when those numbers aren't where they're supposed to be. So then it's a problem, and we become the problem, and we beat ourselves up. I'm not, it's I'm not good enough. I'm not doing it right enough, whatever it is. And so what's important is to let the numbers inform you, but not define you. You aren't your disorder. You aren't your disease. I remember when I was in medical education, there was a big shift. This was about 25 years ago, from talking about diabetics to people with diabetes. And do you see the difference? One is labeling people by their disorder, and the other is they are people and they have diabetes. So
They're a human, they're person first.
yes,
And there's a part of their story that is diabetes, but the story is much larger than their condition or their or anything.
yeah, that's you said it just so beautifully. It's about the story, up the sum total of who the person is, and also you said people first, and that's exactly what we talk about in language. Use people first language. So what does that mean? It means um, um, Joe is not the diabetic. It's Joe, who's my friend, who this is and has diabetes. He's not the diabetic. So I think that's one thing that you can do instantly. You are, you're not you're not the broken leg, you're not the diabetic, you're not the depressive or whatever. You're a person with a big story, as you said, Glenn. So also, along with that, so how do you get away from judging yourself? And so we want to let the data inform us, but not define us. How do you do it? Describe, but don't judge. So what does that mean? Instead of saying, I completely blew my diet today, I screwed up, I'll never be able to get it, just describe the behavior without all the other self-damning stuff. What did you do? I had seconds on dessert today. And what's a hint that I'm still, and then ask yourself, okay, so I had seconds on dessert today. What am I still doing that keeps me on that path to change? Think and think. Well, I didn't have 3 helpings. You're right. You didn't have 3 helpings. How did you stop at just 2?
This is
That's one I
interesting.
think.
Yeah, that's interesting. And the description of the behaviors is like saying I am someone who has diabetes versus I am a diabetic. Instead of I messed up my diet, I'm falling off the wagon, describing the behavior like I had a extra piece of pizza for my stories, always pizza, or the dessert. Um, how does that subtly change the relationship with this information?
Oh, I think that's a great question, because identity we tend to think of as permanent. I am somebody. It defines us totally. It doesn't leave any room for flexibility or change or adaptation. It can be pervasive, and it's always personal. So the danger is to make whatever you do permanent, pervasive, and personal. I'm a screw up. Nobody loves me, and I'll never get invited again to the party. So describe, don't judge, don't label it. It's a behavior. What that does is it puts your attention where it should be, because you can control your behavior. So you also shape your identity, but that's a much longer process. So you can notice that you had seconds on dessert today. Okay. So what does that tell me I need to do? Well, tomorrow I better go easy. Oh, okay. How are you going to do it? I'll have fruit instead of cake. Um, and then ask yourself, well, what do I know about myself that tells me I can do that? There's where we get to the identity piece about what are those traits that I have that I can harness to succeed.
The moment you say, I'm not eating well, or I'm failing at my goal to reduce my A1C, the moment you identify with that completely closes down any options for you to think of creatively of how you can continue to improve, because we know change isn't linear. It goes ups and downs. And so we have to be flexible with different ways. The moment you identify that completely is you're not giving yourself the flexibility to be open to options.
Exactly. You aren't your deficits or your problem. You're you. There's a lot more to you, as you said, well, a lot more to the story. And so we want to stick with the specific details. There's ideas about how couples should fight. Is don't generalize. What was the problem today? Let's only talk about today. We don't want to make problems permanent, pervasive, or personal. And it goes whether you're a couple having a disagreement or you're talking about your what you ate. Stick with the evidence without judgment, with description, and also saying, and what do I want in the future? How will I behave? What can I do in the future to be more of who I want to be? So it's not to fix the problem, but it's who do I want to be tomorrow? I want to be somebody who eats fruit more often for dessert. Okay, great. What are you going to choose? Well, I think I'll put out an apple, or I'll go and get some bananas, or whatever it is.
All right, so let's circle back around to this A1C number that the doctor told me, or the cholesterol number the doctor told me. And so obviously there's a lot of behaviors that I could do to change to improve those numbers. And then I go back to the doctor, and the doctor says, your number isn't changing fast enough, whether it's up or down, or whatever the markers could be. I'm not sure whatever your number is, whatever the number is, it's not changing in a rate that is what is expected from the doctor for the results that they are trying to help you with. So how do you manage that with yourself?
Well, first of all, I'd make sure that I understand what the meaning of that number. For the doctor, it's a number, and they have their standards, and they know what it means. But you need to know what it means, and it's not just that it's not that it's a number. The number, what does it mean? It means that if my A1C is high, if my cholesterol is high, my blood pressure, it means that down the road I might not be around to play with my grandchildren, and I don't know if how many of you remember Bill Clinton was a little chubby, and he went on a plant-based diet, lost a tremendous amount of weight, even though obviously his doctor has been telling him for years, hey, cut out the burgers and fries. Well, how did he do it? He connected the number to what he wanted and the meaning bringing that down that number would have for him. And what did he want to do? He wanted to be able to walk Chelsea down the aisle when she got married. And now I think she's got a couple kids. So he probably is keeping up his, whatever he's doing, he's keeping his weight low because he wants to be able to play with his grandchildren. So to the doctor, it means something clinically to the doctor. You have to ask, and what's the risk if I don't do something? And what is the benefit? when I do bring that number down. And that's write that question down and ask the doctor, what difference will that make in my life, in what I do, and how long I live, the extension of my health span? What does that mean? What will that mean for me in real terms, in concrete terms, day-to-day living terms, when I bring that number down, so that you understand the significance of it? And then, so how's that sound so far?
No, that's fantastic, because what it tells me is, I love your Bill Clinton example, because obviously he had the best doctors in the world working on him as president, and they were telling him to reduce this number. But it wasn't until after he really realized, hey, though, this is what I want. This is something that's tangible, meaningful for me. That's really intrinsic, that I want in my life, and I need to. It wasn't about the number anymore. It was about walking his daughter down the aisle, and the number just happens. The number just happens when you go after this goal. And so I really like that conversation you want to have with your doctor when it says, "Oh, your number's not coming down with it." Well, maybe then I don't really know what difference this is going to make for me. And so, can you explain to me, what difference is it going to make if my A1C doesn't come down, or whatever marker that we're trying to change doesn't happen? What difference will that make for me? And they're going to give you a general idea, but then ask yourself, well, what difference is going to make for me in my life?
Exactly. And that reminds me of how to read statistics, right? We're bombarded with health statistics. They'll say, this reduces blah, 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 50%. There's a difference between statistical significance and clinical significance. Statistics means it makes a difference, but clinically means, does it make a difference to your patients? So let's say something, you eat more blueberries. It reduces your risk of cancer by 50%. But if you're 20 years old and you have no other conditions, the likelihood of a 20-year-old dying of cancer is minuscule. So by cutting your risk in half, it doesn't make any meaning. That's the difference between the statistical and the clinical. The clinical is, you're 20 years old, it's not going to make any difference. So make sure you know what your data really means. And that's why the reason to ask your doctor, what does this mean in my life, for me at this point in my life?
So what do you do? What else would you do? You got this number. We've tried it. We've made distance with it. We're trying to get some meaning around it. What difference does it make? Well, obviously that's going to be such a huge impact, because you're going to be driving towards that and not really worrying about the number. The number will happen on its own. What else could you be doing?
Well, one thing is, well, let me tell a joke before I to give you the punchline. So there's just a joke. Some tourists are wandering around New York City. They're very lost, and they're getting really upset because they're late for a concert that they paid a lot of money for. And so they stop at a sidewalk coffee vendor and they ask, how do we get to Carnegie Hall? And the vendor says, practice, practice, practice. And so I say that because, like, what can I do? The doctor gives you, your whatever's too high, too low, you got to do this. And then you jump to it. And Glenn, I know you have had quite a career as in athletics. I mean, would you ever get to the starting line not having rehearsed or practiced?
No, I mean, it would be just a disaster not being able to, both mentally, not even the performance, just mentally getting up there. You wouldn't be able to be prepared for it.
Right, exactly. And that's what we do with our health or with our eating. We just think we have to jump to it without really paying attention to what we need to do to prepare. And there are lots of things to prepare. Is that you talk to yourself, why you're doing it, how to do it. And in fact, one doctor I used to work with said, the problem with us doctors, we tell people what to do, but we don't tell them how to do it. And then I said, and there's a lot of other stuff that you don't say. And that is what we talked about meaning, but how do I do it? What's my environment? Is it conducive to me taking on changes? How do I adjust my environment to support me? Who's around me that's supporting me? Do I have everything I need? What doctors have found is they make prescriptions. They never ask the patients, oh, and by the way, can you afford this medication? because so many people can't. But it's, do you have the setting and practice? So it's not just get everything, but it's like you get a recipe. Great. I'm going to cook. We know if you want to be healthier, cook your own food, cook at home, eat meals at home with people that, if you're in a relationship with people, in a social setting. But how can you do that if you don't know how to cook? So that's where practice, rehearsal. So practice is the discrete skills you need to do the thing. But rehearsing is setting the stage. And that's what happens. You can rehearse physically. Okay, I'm going to, practice is I'm going to practice chopping onions. A rehearsal, I might put everything out that I need to get ready. So when it's time to stir fry those veggies, they're all ready. The curtain goes up. I stir fry, I serve dinner. And the rehearsal also means imagining in your mind, seeing yourself going through these actions, noticing yourself, and preparing.
Yeah, and I think that imagining yourself doing that is something that is often underutilized as a tool for change. Our brain doesn't know the past, present, or the future. So when we are doing this visualization, whether it's for these healthy behaviors that we want to have, or an an athletic or music endeavor, or any pursuit that we want to do, all high performers do this visualization, and it's because of that we don't know the past, present, and future. So our brain is already doing the action that we have dreamt about. So that way, when we go to do it, it's like, oh, I've already done this. I've already driven down this road before. I know the turns. I know the twists, and that makes it infinitely easier to do it.
Yeah, that's absolutely the case. There isn't a top performer who doesn't mentally rehearse, and they don't worry. They're not rehearsing their problems or how to fix the problem. They're rehearsing themselves at their best.
And that's
So
important because you don't want to rehearse your problems, because you don't want to we don't want to repeat that image, and you don't want to go back and do that again. So, and that's even with thinking about your past mistakes. You don't want to relive those, because you're actually putting them in the future when you're reliving them. This is again, the past, present, and future is not a difference. So you don't even want to go down that rehearsal of the
absolutely.
negative. Yeah.
Yeah. And take into account, so rehearse, imagine, just visualize yourself doing the behavior that you want to do, and in all of its many forms, the environment, the tools you'll use, if it's eating, the dishes you'll eat on, who will be around, who you'll tell, who you'll ask for help. I mean, there's so many factors that influence behavior. Um, and notice when things are going a little easier for you, when you do drink the cup of black coffee instead of the frappuccino with whipped cream. What enabled you to do that? And take the time to smell the roses, because I think also that's another thing, is that we know from all kinds of mindfulness practice that when we are more present, um, it helps us appreciate life more. And I think that also helps us be grounded and do valued action.
Take time to smell the roses. Literally smell your food. And we actually have a new mindful eating assessment that you can take, and I'll put the link in the show notes. Well, this has been fantastic. The key we started off here is we got this number from our doctor that we have to change, and we talked about changing the relationship with it by distancing ourselves and saying that just one, it's a part of our story. It's not, we aren't that number or anything around it. And then we went really to a point where we're talking about what difference is that change going to make for me, that number, changing that number going to make for me, and how that would fall to the wayside by just working towards the change, going for that, walking down the aisle, or playing with the grandkids, or doing whatever activities you want to do with your friends and family. And it is in a community setting. And I think that's one of the key parts you brought up, is when we're doing this, we're working on healthy eating, is how do we bring the people in our lives along for it. And then again, finally did that visualization. visualizing how you're going to act, and not underutilizing that key skill that everyone that is performing at their best does.
Absolutely. Yeah, it's about really, you said at the beginning, it's the whole story, and take the whole story into account, and keep at the center of, you are at the center of that story, and who do you want to be at that center of the story when you are at your best?
Well, that sounds like a fantastic place for us to wrap up. If this was helpful, hit like and subscribe. It helps at the algorithm, because we talk about solution-focused strategies every week to improve your health and well-being. And we also have that healthy eating assessment that we have the link in the description. And also we have an upcoming quest. It's a 2-week quest where we're going to talk all about healthy eating in the context of our solution-focused approach. And it's called Healthy Eating Quest. Fuel the life you want to live, a science-backed, flexible way to eat. No shame, rigid rules, or deprivation. And if you want to learn more about our unique solution-focused approach, book a complimentary coaching session at staminalab.io. That's staminalab.io. And put any questions or comments below. We'd love to answer those. Thank you, Dr. Teplow.
Thank you.
And thank you, everyone, for listening. Until next time, remember, you are your own lab, you are your own experiment, and you are your own best coach. Be well.